Well, good morning, everyone. And how are you? And once again, welcome to another live this morning. We appreciate you guys coming on with us. And thank you for your loyalty. We appreciate the fact that you take time every day to watch our program 5 days a week. And as you get your notifications, let me see if I can say hello to a few friends this morning. Yeah. There we go. Andrea, you are number one on the hit parade today, and Kevin right at the top from Oshawa, Andrea from Niagara Falls, Rosalinda's from Niagara Falls too, Nativity, Sandy, Chilliwack, British Columbia, 2 Sandys in a row, Sandy from Fergus Falls, Minnesota, Madeleine, Kippawa, Quebec, Natalie, how are you? Carrie, Nebraska. Vanda, PEI. Deb, hello. Jasmine, and Janine. Maria, Patricia, good morning from Florida. Dave, Nick from our staff is watching. Grace, Bonnie, Little Britain, Elaine, Georgie, Halifax, Nova Scotia. Hi, Kim. Cheryl from West Virginia. Good morning, Cheryl. Francis from Vaughan. Sully, Petawawa. Derek, good morning to you. Marla, Ottawa. Karen, Eileen, Brampton. Karen from Innisfil. Joyce, good morning from Kansas. And let me see here. Marlene, how are you? Julie, Minnesota. Love you. Thanks for coming on. Lise, right from my hometown of Sudbury. Rhoda, Wanda from Virginia. Good morning. Couple of more here, guys. We get going here. Denise, how are you from Oakville? Hi, Deb from Timmins. Nellie, Laurie, Cambridge. Shirley, good morning. Marianne, London. And Donna from Newfoundland. We love Newfoundland. We love Saskatchewan too, Kristen. Brahim, what happened? You're way at the bottom. From Portland, Oregon. Brahim is a good friend to this program, and we love you dearly. Carol, New Brunswick. Donna, Adeline, Helga, and Cheryl said she's singing for me. Brahim says he's not getting those notifications. Madeleine and Patricia, Huguette, bonjour, de Hearst, Ontario. We love you guys. Thanks for coming on. Hey, you know what today? I got to tell you, somehow, some way we're going to celebrate this. I don't know exactly how yet. We hit 90,000 followers on Facebook. Okay? 90,000. I love it. Okay? I love it. 90,000 followers on this program. The doctor is in. I'm overwhelmed. Thank you. And like I said, I just contacted Tony Jr. and I said, man, we got to do something for 90,000 followers on our Facebook. Hey, we love it. And look, we understand not everybody can watch us live every morning. It's just not possible. But we do thank you for flipping over to the Doctors In podcast and picking it up there. Or you can watch this one on a delay too, of course. Okay? So let's get to our questions because we're continuing Q&A. And I'll go down to the bottom and start from there, and then we'll try and hit every question today that we didn't cover on Friday. Samia is asking, with fibromyalgia and osteoarthritis and sleep apnea, okay, how much Navital and cortisol can I take daily? Well, let me just say this before I tell you what to do. Okay, Samia, with fibromyalgia, osteoarthritis, and sleep apnea, the first thing that needs to happen is you have to lower your insulin. And that's food. So supplements, yes, and you're actually right. I love Navitol. I've shown that clinically to work with fibromyalgia, chronic fatigue syndrome, okay, which are sisters. Take a coin and it's double-sided. CFS, chronic fatigue syndrome, and the other side is fibromyalgia. I was one of the first people, when I wrote books, still writing books, but wrote a book early, when I say early, late 80s, 1990s, on chronic fatigue and fibromyalgia. I connected the two. Okay, I connected the two. They're very much adrenal gland exhaustion. Fibromyalgia and CFS, okay? And they're very much connected. Anyway, but diet, lay off the sugar, very low carb, and that is for how long? Forever. What your body demands is protein and fat combined. Eggs, meat, cheese. Okay, you can have some fruits and vegetables. I'm not against that at all. Processed foods and sugars. Lay off big time, because if you got to get your insulin down, okay, then with CFS and fibro, I'm very big on Navitol, because that was what changed the ball game for us, because it actually crosses the blood-brain barrier. It's a natural antioxidant, very powerful, and it elevates your glutathione, which is really important detoxer that your body makes. It elevates that. It elevates your nitric oxide, opens up your blood vessels, better blood supply, and very anti-inflammatory. Okay, that's why we love the pine bark extract. And cortisol is because I talked about the adrenal glands. One of the biggest issues, it's stress. And that constant secretion of cortisol. Like, cortisol's on your side, but you can't use it all the time. You can't overuse it. That's where adrenal exhaustion comes in. So, yeah, if you were a patient of mine and you were coming in for the first time, I'd probably I have you on probiotics too, guaranteed, because leaky gut's involved. And then the diet, 100%. I'd have you do the reset, a 30-day program, and then the supplements, pine bark for sure. I would probably start you off at a very high dose for a couple of weeks, even a month, depending on how bad your symptoms are. 4 and 4. 4 cortisol, 4 Navitol a day. And guys, I'm telling you, it makes a difference. It really does. Okay, thanks for the question, Samia. Anna, I was told that chocolate bone broth does very slightly break a fast. Is there anything else you can share on more information? Anna, I'm glad you asked the question. Because fasting, intermittent fasting and fasting has become a big thing over the last several years. People are talking about it. And I like fasting. Okay? I do. I don't, look, if you were given a diagnosis of cancer, I've seen some study that shows if you do a 72-hour fast, just water and coffee, you can have coffee. There seems to be some research that actually helps to shrink tumors, okay? Now, here's what I'm big on. Okay, you have to understand where I'm coming from, and I'm adamant about this. Okay, Adam, I don't care how much you fast or intermittent fast, you can't out-fast a bad diet. You can't. So I put my building blocks in a row. 1, get your diet right. Forget fasting for a minute. Get your diet right. I'll tell you why. Because one of the biggest problems in our society, 93% of the people have this problem. It's called metabolic syndrome, and it's at the root of all chronic disease. Kennedy last week talked about 70-something% of the population in the US of A, I think it was 76 if I'm not, have chronic disease. Holy smokes. All the tea in China ain't gonna fix that. But at the root of that is metabolic syndrome, and that's 93% of the population. They have trouble with insulin. And the only reason you would have trouble with insulin is because you're a carboholic. Way too many carbs, crappy carbs, and sugars added, especially high fructose corn syrup. Okay? So, at the end of the day, fix that. I like fasting, but I like fasting without fasting. What do I mean by that? Because if you eat the right foods, let's say you have a steak. You know how much insulin you need when you eat a steak? An eensy-weensy, teeny-weeny, yellow polka dot bikini. Remember that song? Well, just a little wee bit. You have an egg, your pancreas is on holidays. Do you understand what I'm saying? So you're really fasting without fasting if you eat the right foods. I almost called my book, the 30-day reset that I called, okay? The metabolic reset. I almost called it fasting without fasting. Now look, I like intermittent fasting, meaning that don't eat at night. It's a key. Okay? Now, a lot of people, they don't eat at night, and they don't eat till noon the next day. They're going into an 18-hour fast. Really? That's intermittent fasting. But if you stop eating at 6 o'clock and you go to 8 o'clock in the morning, okay, now you're at 14 hours. That's when really the studies have shown that that's when fasting actually occurs. 14 hours, okay, and above. I like that. If you can do it. Some people can't fast like that. But if you can do it and you feel good, hey, I'm 100% for it. So when you have bone broth in the morning, okay, let's say you're having bone broth. Technically, you put it in your coffee. Technically, you're stopping a fast. But again, you're not using insulin. So you know what? I don't count that. You put cream in your coffee. I don't know why you do that. No, I'm kidding. No, a lot of people like cream in their coffee. Does that break your fast? Technically, yes, but I don't consider that breaking a fast because you're not using insulin. It's not calories, it's insulin. You see where I'm coming from? If you get that, you'll understand. How much insulin do you need when you are eating? You're eating a donut, lots of insulin. A muffin, lots of insulin. Cereal, lots of insulin. You see what I'm saying? Okay. Thanks for the question. We love you dearly. Okay, let's just see. That was Anna. I can't remember if I answered this or not. She had pericardial effusion and, a buildup of fluid around the heart. Look, I'm big on, here's heart for me, okay? 1, CoQ10, ubiquinol, and not ubiquinone, ubiquinol. Why? Because your heart's got a lot of battery packs, especially the heart and the brain. You got lots of mitochondria. Those are your battery packs. You need to protect them. CoQ10 does it. Ubiquinol. Okay, 1. Especially if you're on statin drugs. 2, I love high DHA. Why? Because it lubricates your blood vessels. And that's really important, okay? Lubricate your blood vessels. Lubrication. I love Navitol. Why? Opens blood vessels. Okay, high DHA, what does it do? Lubricates. You go get an oil change on your car, they give you a lube job too. Okay? And you want to open up your blood vessels, those little capillaries and everything around your heart. Open. Nitric oxide, pine bark, Navitol. So ubiquinol, CoQ10, high DHA, Navitol. Magnesium too. I like magnesium. Okay? I really do. Okay. Thanks for the question. Let me see. That was Patricia. Okay. And Michelle, well, look, Michelle, I think I answered this. Can you explain natural ways to improve fibromyalgia, especially in men? Okay? Remember, diet, insulin, get it down, high protein diet. Here's what usually fibromyalgia, I made some notes here. Hold on, let me see if I can find them. Oh boy. Okay. Here's what I did on fibro. Reset, probiotics, leaky gut, always present in fibromyalgia and CFS. Vitamin D, B12, big time, because they're usually deficient, usually. Navitol, cortisol, we talked about that. Fix sleep as much as you can. That's why cortisol helps with that. And drink at least 2 liters of water a day and drink coffee too. Okay? Lay off those sugary drinks. Thanks, Michelle. Can I take this is Madeleine, can I take the thyroid supplement with levothyroxine? Yes. Thousands do. If you have to take the medication for thyroid, that's not fixing anything, but, okay? Like I don't tell people to come off meds. Especially now that I'm not in practice. I'm just giving general advice. But you can take, because that thyroid, see, the thyroid is a puppet. It's got a lot of strings attached. And our thyroid formula was made to touch all of those strings that are attached to your thyroid. From your pituitary to your hypothalamus in the brain to the T4 getting converted to T3 in the liver. We help all of that. Those supplements, those ingredients in the supplement were all designed to work on a specific string that is attached when it comes to the thyroid. Madeleine, thanks for the question. Bonnie, you have had 2 flare-ups in the last 3 months of diverticulitis. That ain't no fun under the sun. Now, Bonnie, okay. So you're eating right, looks like. No sugar, no carbs, good for you. My question is, could eating this way cause no. Listen, diverticulitis comes from diverticulosis, okay? Where you get pouches in the bowel. And I can tell you, this didn't happen overnight. This happened a long time ago. It was a long time coming. Here's what I found. It's the opposite of what people think, Bonnie. Okay? It's the opposite of what people think and the opposite of what doctors think. They tell you the solution is you need to eat more fiber. I tell you the problem is fiber. And here's why I say it. I don't just say it to be controversial. I say it because I found it to be the case in my practice for years and years and years. Okay? Here's what I'll tell you. Diverticulosis, okay, those pouches in the bowel, they happen mostly to women. Okay, that's a clue. Okay. What do women eat? Mostly. Salad. Men look at salad like most men, not all men, okay? They look at salad going, well, that's just an add-on. Where's the beef? That's most men, okay? Again, don't come after me because I'm making generalities. Women, especially since I watched it happen, the 80s, the 90s, the 2000s, red meat bad, fat makes you fat, therefore salad better for you, nothing better than a big bowl of salad and greens, and it's the best. Spinach is the best, man. Salad, okay? Maybe a little chicken in it. That was, and low-fat yogurt. I heard that for tens of thousands of patients that came to see me. And almost invariably, it was women who got diverticulosis, and they were big salad eaters. And I used to tell them this. When you eat spinach, does it get caught in your teeth? Oh yeah, doc, I gotta go look in the mirror, make sure when I had my salad, didn't get caught in my teeth. I said, yeah. Well, you know what? That same salad, it's getting caught in your bowel too. You got an irritated bowel? Lay off the salad. Because you're not a cow. A cow eats salad. But they got 4 stomachs. A rabbit eats salad. You know why? Because they got cellulase. You don't. You don't even have that enzyme. You weren't built to eat salad. What? You really weren't. You might like it, but you weren't built to eat it. And I'm not saying, okay, don't get me wrong here. I'm not saying you can never have it. Okay? I'm not saying that. But you can't convince me when I know what the digestive tract looks like and is made up of in a human being, you were meant to eat meat. Your body's biochemistry, your body's biology, it was made for that. From the acidity in your stomach and the length of your colon. Okay? It's the way it is. And diverticulosis, I used to get tremendous results by regenerating the gut with mucilages, probiotics, like our diet. You got to start right in the stomach. Break that food down properly. A lot of people don't, because they don't have enough acidity in their stomach. They need to break that down properly. And what do? You need to be taking digestive enzymes. And then I would have them on probiotics, because probiotics are little bacteria on your side. They help to not only heal the gut, but also to help digestion. And then mucilages. That's why, I like our gutties, because it coats. That's why I like bone broth, because it regenerates with all that L-glutamine. It regenerates the lining of your bowel. And I know that's the opposite of what you're told out there. You need more fiber. You got to clean that bowel out. Yeah. I disagree with that. Okay? I disagree with that. If you've had a couple of flare-ups, you need to, I'll tell you, don't eat at night. Don't eat at night. Do some intermittent fasting. Drink a lot of water. Coffee. Okay? Coffee's your fiber. Okay? And make sure you're on those right supplements. Okay. That was Bonnie. Jacques, how to prevent anaphylactic reaction to a bee sting. Well, look, probiotics, 100%. Okay? 100%. Because to some extent, it's autoimmune. And to elevate your T cells and that, and your mast cells, well, there's nothing like the sun, Jacques. Like vitamin D. Vitamin D is the best thing. You're a solar panel. Your T cells and even your mast cells have antennas looking for the sun. Okay? Merci beaucoup, Jacques. And when I sit in the sun for 20 minutes, do I need to take K2? No, you don't. That's a good question. I like it. I'm laughing a little bit because I want you to eat your K2. When you have cheese, you got calcium and K2. When you have an egg, you got calcium and K2. When you eat meat, you have calcium and K2. You see, God put it in nature for you to eat it. Now, if you're taking a supplement of vitamin D, we recommend K2 in it. Okay? We really do. So remember, with vitamin D, one of its benefits is it helps your bones. Well, it helps calcium get to your bones, especially when you put it with vitamin K2. That's why we do that. And we don't want calcium staying in your bloodstream. Calcium don't belong in your bloodstream. Well, a little wee bit, but not much. You want it in your bones and in your teeth. Okay? And K2 helps deliver it. Okay. That was a good question. And thank you. Patty, COPD, what do I do? I like quercetin and Navitol, the combination. I'm big on quercetin, guys. It's very good. We wrote an email, I don't know if it was last week or the week before, whatever, on quercetin and uric acid. It really helps to lower uric acid. But quercetin's always been famous sort of as a natural antihistamine. And quercetin is tremendous for lungs. Okay, I love quercetin. Okay. But I combine it with Navitol. I really like that. Navitol just opens up those blood vessels, even in your lungs. Circulation, circulation, circulation. Okay. Colleen's saying I might have answered this the other day. Now I don't remember. I'm pulling out my senior card. Okay. I should have flagged the ones I answered here. Colleen asking about vertigo. Well, vertigo can be viral. Okay. Vertigo, you can get positional vertigo, and that can be calcium. Calcium. Crystals. Calcium crystals get displaced in your middle ear. That can give you vertigo. Okay. How does that happen? Sometimes viral. Sometimes out of nowhere, you can get vertigo. Okay. Boy, we see it a lot more than ever. If you look at, well, I don't even have that chart anymore. I used to have a chart in my office, okay? And here was the question. Do you have insulin resistance? Because people didn't know what I was talking about. But I used to have charts in my office, and when they were sitting in my waiting room or they came into my office, they'd see these charts. Do you have insulin resistance? And it shocked them. One of them was vertigo and tinnitus. Very much related to insulin resistance. Not the only cause, but can be a cause. Okay? So thanks for asking that question. Roseanne has Sjogren's, which is autoimmune. Okay? I used to see it a fair amount in my office. Well, look, no saliva. She's having trouble. A lot of people have trouble, very dryness of the, they don't make enough saliva, don't make enough lubricant even in their private parts. Okay? And I used to help patients like that because it's autoimmune. Leaky gut, big issue. Always start with the gut. We started with probiotics, get them off all sugars, do the reset. I had them on Navitol, probiotics. They were often low in vitamin D. I check all that and make sure, and we would help them on that. Louise, my husband has a spot close to his ear on his face. When I press on it, it hurts. What is the cause? Well, it could be a lot of things, Louise. Okay? You can get a spot, what is it, rosacea? Possibly. Okay? Again, that's auto. Anything I see on the skin, usually I go, Louise, back to the gut. Okay? Leaky gut, leaky skin. So a spot, okay, you might have to get it checked out. Send me a picture of it so I can see it. I'll give you a better idea. Okay? Leaky gut, leaky skin. Let me just see. I think I answered Mary. Phyllis, did I answer this the other day? Have a cough for 10 to 15 years now. You're allergic to yourself, Phyllis. No, sometimes that can be, it can be, I look up and then I look down. Okay? I used to look at sinuses, post-nasal drip for a cough, or I look down, stomach, not enough acidity, and the body's making, and it's a silent acid reflux, and you're coughing all the time. Look up, and then look down. Okay? Okay. I answered that the other day. Okay, this is Amy. I suspect that I have high cortisol levels. Well, fix that. If you got any kind of stress, I can guarantee you have high levels of cortisol. Okay? Fix. She suspects that my lymphatic system is sluggish. Okay? Drink water. You want your lymphatics to work, your body's drainage, the best thing for your lymphatics is H2O, and only H2O is H2O. Okay? That really helps. And I'll tell you something else, okay? Because I know you can get lymphatic drainage, exercise, the rebounder. I love that. That's one of the best way to get your lymphatics going is a rebounder, okay? So a lot of people, I used to get my patients doing that. Do that. Okay. That was Amy, okay? And she believes her hormones are out of whack. You got hormones, Amy. You and millions of others. Linda, you say. Linda, listen. She says, I say. Okay, what do I say? That apple juice is not good for you. I say that. God meant you to eat fruit, not drink it. Now you can have a few berries in Dr. Martin's Perfect Smoothie. I actually recommend that. But people that just drink apple juice, eat it. You want to eat an apple? An apple a day doesn't keep the doctor away. A steak a day does. But you can have an apple they're good for you. I got no problem. Have an apple. Eat it. Don't drink it. Okay, my husband, what did he say? Even if it's squeezed from hand, he's trying to get around my rules. Don't drink it. I know it's got all the pulp in it. And I guess that's a little better, but it doesn't matter. It's going to go to your liver right away. I don't want you to drink juice. I want you to eat it. Drink water and coffee and not juice. And you can have Dr. Martin's Perfect Smoothie. Okay? That's good for you. Okay, I love it. Oh, and Linda's going, nattokinase, is it a good supplement to use for heart issues? Well, if you are suspicious of a clot, I got no problem with nattokinase. Okay, I really don't. I'm bigger, for me, I'm much bigger on what I talked about earlier. Heart, ubiquinol, Navitol, high DHA. There's nothing better than that in that trinity for your heart. And vitamin D too. Very anti-inflammatory. Okay, let me just see here. Let me see, Robin, my doctor did full labs. Everything came back normal except for my globulin protein was low. Okay. But doctor's not concerned. I'm not concerned either if it's just that. Because whenever I saw low globulin protein, I'm interested on your kidney, the other kidney function test, and your liver. Okay? And your liver. And that's why I think your I know, because you told me. Your doctor's not concerned, and neither would I be, because if that's your only finding, I'm not worried about that. Because if he did your liver enzymes, and those enzymes came back normally, good. I'm not concerned about low globulin protein. And your kidney function, if the other kidney function tests are good, I'm not too worried. You might have been a little bit dehydrated when you had the testing done. Make sure you're drinking, Robin, lots of water. I don't drink milk as I'm lactose intolerant. I'm gluten-free. Okay, good for you. Clearly, my body has trouble processing proteins. That's not what it means. That's not what it means. Okay? Well, not that test. That's not really the processing of proteins. Okay? If it's low, that's not the issue there. I like I said, I'm not too concerned, Robin, either if your kidney function tests are good and the other ones, and your liver function tests are good. Rebecca, I think this might be the last one. Mirifica, which is a supplement. It's a powder. It's a root powder used for menopause over the years. You're saying that you got good results with it? Hey, good for you. If you find good results with it, see, for me in menopause, like one thing like Mirifica, I never found it to be that effective on its own. Combine it, better. And for me, like that's why, like if you look at our formulas, the menopausal formula, for example, you see how many in there? 5 or 6 ingredients synergistically. I just found, like for me, I had patients take that and the results weren't overwhelming. But I tell you, Rebecca, if you get good results from it, no problem. And you're asking, is it safe for long-term use? Well, look, there hasn't been a lot of studies on it. From what I saw, I haven't seen anything alarming. Okay? I haven't seen anything. If you're getting results, good for you. I'm on your side. I just want you to feel good. Okay. I think I got it, guys. I think we're done. Q&A Friday and Q&A Monday. Okay, so 90,000 and counting followers on Facebook. We got to have a party of some kind. I don't know what we're going to do, but let's party, guys. Thank you so much. How can you have 90,000 followers on Facebook? Isn't that beautiful? I appreciate that. It's you guys. Okay. Thank you for that, guys. We love you dearly and sincerely. Okay? Talk to you soon.